Welcome to this GI Pharmacology Study Guide presentation. We will review acid suppressants, antidiarrheals, laxatives, antiemetics, GERD, and key nursing considerations for BS. Here is our agenda. We will cover GERD overview, antacids using the SCAM mnemonic, H2 receptor antagonists, proton pump inhibitors, mucosal protectants, antidiarrheals and laxatives, and finally antiemetics. Gastroesophageal reflux disease, or GERD, is a chronic condition in which stomach contents flow back into the esophagus due to a weak lower esophageal sphincter. Key symptoms include heartburn, regurgitation, chronic night cough, and difficulty swallowing. Major complications include Barrett's esophagus, which significantly increases cancer risk, esophageal strictures, and aspiration. Patient education for GERD is critical. Teach clients to avoid eating within 3 hours of bedtime, eat small frequent meals, avoid trigger foods such as fatty foods, alcohol, coffee, peppermint and citrus, elevate the head of the bed, lose weight if needed, and stop smoking. Antacids neutralize acid quickly but have a short duration. Remember the mnemonic SCAM. Sodium bicarbonate can increase sodium load. Calcium carbonate and aluminum hydroxide cause constipation. Magnesium hydroxide causes diarrhea and should be avoided in renal failure. Always separate antacids from other medications by 1 to 2 hours. H2 receptor antagonists block histamine receptors on parietal cells and decrease acid production. Common agents include cimetidine, ranitidine, famotidine, and nizatidine. Key points: give at bedtime, watch for confusion in older adults, thrombocytopenia can occur, smoking decreases effectiveness, and cimetidine can increase the effect of warfarin. Cimetidine is also associated with endocrine effects such as gynecomastia and decreased libido. Proton pump inhibitors, or PPIs, irreversibly block the proton pump. Remember the Ps, prazoles such as omeprazole and lansoprazole, they pause acid production, prevent ulcers, treat H. pylori, can cause porous bones with long-term use, and patient education is to take them 30 minutes before meals, preferably in the morning. Long-term PPI use carries important risks: vitamin B12 deficiency, increased fracture and osteoporosis risk, higher chance of C. difficile infection, and potential interference with clopidogrel. Omeprazole can also raise levels of diazepam and digoxin and increase bleeding risk with warfarin. Sucralfate is a mucosal protectant that creates a protective plug over the ulcer. It must be taken on an empty stomach, 1 hour before meals and at bedtime. Maintain a 2-hour separation from other drugs because it binds extensively. Constipation is the biggest side effect. Misoprostol is another protectant but is contraindicated in pregnancy. Antidiarrheals come in 4 groups: opiates, somatostatin analogs, adsorbents, and bulk-forming agents. Do not give them for bloody diarrhea, high fever, or suspected infectious diarrhea, because slowing motility can worsen the infection. Also avoid an inflammatory bowel disease due to perforation risk. Teach short-term use only and that probiotics help restore flora after antibiotics. For constipation, first rule out obstruction. No stool plus vomiting plus distension means hold laxatives and notify the provider. Bulk-forming agents like psyllium are safest for long-term use when taken with plenty of water. Stool softeners prevent straining. Stimulants work in 6 to 12 hours but risk dependence. Lactulose is used in hepatic encephalopathy with a goal of 2 to 3 soft stools per day. Antiemetics include several classes. Ondansetron is a serotonin antagonist used for chemo and post-op nausea. Watch for QT prolongation. Metoclopramide is a dopamine antagonist that also promotes gastric emptying but can cause extrapyramidal symptoms. Antihistamines and scopolamine are useful for motion sickness. Promethazine can cause severe tissue damage if it extravasates, so stop the infusion immediately if burning occurs. Quick comparison of acid suppressants: antacids act immediately and must be separated from other drugs. H2 blockers are best at bedtime and can cause confusion in the elderly. PPIs are the strongest, taken before meals, with long-term risks of B12 deficiency and bone loss. Sucralfate requires an empty stomach and a 2-hour gap from other medications. Key takeaways: Always separate antacids and sucralfate from other medications. Take PPIs 30 minutes before meals and monitor for long-term risks. Give H2 blockers at bedtime and watch older adults for confusion. Never give antidiarrheals for bloody diarrhea or fever. Rule out obstruction before giving laxatives. Monitor QT interval with ondansetron and extrapyramidal symptoms with metoclopramide. Thank you for reviewing this GI pharmacology guide. Study the full PDF and ATI quiz for additional practice.